this is Dr. Emma Hitt-Nichols, and this is information on the latest US FDA approvals for April 15th through the 26th. I was not able to produce an episode last week, but hopefully we're back on track now. All right, so the FDA has approved vidanacogene elaparvovec DZKT, more easily stated as Beqvez, Beqvez, and that's a gene therapy for adults with moderate to severe Hemophilia B who meet certain criteria. Beqvez is a one-time treatment designed to enable patients to produce the clotting protein factor 9, 1X, which is required for blood clotting. The treatment addresses the significant burden of frequent infusions required by the standard therapy and aims to prevent and control bleeding effectively. Hemophilia B is a rare genetic disorder predominantly affecting men, characterized by insufficient levels of factor 9. This deficiency leads to easy bruising, frequent and prolonged bleeding episodes, and serious complications such as joint damage and mobility issues. The approval was based on findings from a late-stage trial where Beqvez showed superior efficacy compared to the standard treatment regimen of factor 9 infusions. The approval of Beqvez was granted to Pfizer, which acquired the rights to develop and market the therapy from Spark Therapeutics in 2014. Also last week, the FDA has approved Anktiva, also called nogapendikin alpha, imbacicept PMLN, and that's plus Bacillus calmette-guerin BCG for the treatment of patients with BCG-unresponsive non-muscle invasive bladder cancer, NMIBC, with carcinoma in situ, with or without papillary tumors. Anktiva is a first-in-class IL-15 agonist immunotherapy and received breakthrough therapy designation prior to this approval. This agent activates natural killer cells and T cells, enhancing the proliferation of memory T cells, which mimics dendritic cell biology. NMIBC with carcinoma in situ is a form of bladder cancer localized to the lining of the bladder, but not invading the bladder muscle, and can be particularly challenging to treat when unresponsive to BCG therapy. The FDA's approval was based on findings from a single-arm multi-center trial involving 77 evaluable patients who received Anktiva with BCG maintenance therapy for up to 37 months. The trial reported a complete response rate of 62%, with a duration of complete response exceeding 47 months and ongoing, which surpasses benchmarks for clinical significance set by the International Bladder Cancer Group, IBCG. The approval of Anktiva was granted to Immunity Bio Inc. Also last week, the FDA approved Pivya for the treatment of uncomplicated urinary tract infections, UTIs. Although Pivya is not a new antibiotic, having been used for over 40 years internationally and recommended as a first-line treatment in several countries, this approval marks its first availability in the U.S. and is the first FDA approval for an uncomplicated UTI antibiotic in more than 2 decades. Pivya is approved for uncomplicated UTIs caused by susceptible strains of Escherichia coli, Proteus mirabilis, and Staphylococcus saprophyticus. The approval was based on results from 3 randomized controlled trials demonstrating its efficacy in achieving clinical and microbiologic responses compared to placebo, another antibiotic, and an anti-inflammatory. The approval of Pivya was granted to Utility Therapeutics, a UK-based company. Also this week, the FDA approved Tovorafenib, also known as Day-101, an oral type 2 RAF kinase inhibitor for the treatment of pediatric low-grade glioma that is relapsed or refractory and BRAF altered. This decision is based on the results from the Phase 2 Firefly-1 trial, which showed the effectiveness of Tovorafenib in patients aged 6 months to 25 years with this type of brain tumor, and it's the most common in children. The drug, available as a 100 milligram tablet or 25 milligram per milliliter powder, demonstrated a 67% overall response rate with a median duration of response of 16.6 months and a time to response of 3 months. Tovorafenib is being manufactured by Day One Biopharmaceuticals. Also last week, the FDA has approved vedolizumab, also known as Anktiva, for subcutaneous administration as maintenance therapy for moderate to severe Crohn's disease after induction therapy with intravenous vedolizumab. This approval follows the drug's previous FDA sanction in September 2023 for maintenance treatment of moderate to severe ulcerative colitis. Vedolizumab, a biologic therapy and humanized monoclonal antibody, works by targeting the alpha-4 beta-7 integrin, thus inhibiting its interaction with an intestinal mucosal adhesion molecule called MAdCAM-1, which plays a role in the inflammation seen in ulcerative colitis and Crohn's disease. This mechanism does not affect vascular cell adhesion molecule 1, VCAM-1. The approval was supported by findings from the phase 3 VISIBLE-2 study, which showed that at week 52, 45.3% of patients receiving subcutaneous vedolizumab maintenance versus 18.2% of those receiving placebo achieved long-term clinical remission. The latest approval is granted to the manufacturer of Anktiva, Takeda. Also last week, the FDA has approved alectinib, also called Alecensa, for adjuvant treatment after tumor resection in patients with ALK-positive non-small cell lung cancer, NSCLC, detected using an FDA-approved test. This approval was based on the ALINA, A-L-I-N-A trial, a randomized open-label study involving patients with resectable stage 1B to 3A NSCLC who received either alectinib or platinum-based chemotherapy after tumor resection. The trial demonstrated significant improvements in disease-free survival for alectinib over chemotherapy, particularly in patients with stage 2 to 3A NSCLC, where the median disease-free survival was not reached, compared to 44.4 months in the chemotherapy group. These results were consistent across the overall study population, with alectinib showing a median DFS also not reached, compared to 41.3 months for chemotherapy. The approval was granted to Genentech. Also last week, the FDA cleared the investigational new drug IND application for SPG-601 for the treatment of Fragile X syndrome. The clearance marks a significant advancement as SPG-601, a novel small molecule BK channel activator, aims to restore synaptic function and address the core symptoms of Fragile X syndrome. The drug works by inhibiting the activity of large conductance calcium-activated potassium, that's BK channels, which have been identified as deficient in Fragile X syndrome. The phase 2A trial would address the neurophysiological and clinical effects of a single dose of SPG-601 compared to placebo in adult men with Fragile X syndrome. This trial is particularly notable as there are currently no FDA-approved treatments specifically targeting the underlying causes of Fragile X syndrome, which is the most common inherited form of intellectual disability and a significant cause of autism. Fragile X syndrome affects approximately 1 in 4,000 to 8,000 men and women globally and is associated with a variety of severe symptoms, including intellectual disability, anxiety, sensory hypersensitivity. SPG-601 is being developed by Spinogenics, Inc. Also last week, the FDA approved Lumicite, also called pegulicianine, and the Lumicell Direct Visualization System, DVS, collectively referred to as LumiSystem. That's for use in fluorescence imaging during lumpectomy surgeries for adult patients with breast cancer. This drug-device combination facilitates the intraoperative detection of cancerous tissue within the resection cavity, offering real-time high diagnostic accuracy of 84% in identifying residual cancer that might otherwise be missed. This approval is based on findings from the phase 3 INSITE, INSITE trial and other studies, which involved over 350 patients. The INSIGHT trial demonstrated that Lumicite-guided surgery helped identify residual tumors in 27 patients, 7.6%, who would have had unrecognized cancer with standard lumpectomy alone. Additionally, Lumicite reduced the need for second surgeries in approximately 14.5% of patients with initially positive margins. The specificity of Lumicite in the per margin analysis was reported at 85.2%, although the sensitivity of 49.3% did not meet the lower bound goal set for the study. The approval was issued to Lumicell. All right, that's it for this week. I hope you'll check out learnamasstyle.com, learnamasstyle.com if you're a medical writer or even a clinician or somebody in the industry who wants to do a better job writing or editing their writing, then check out learnamasstyle.com. There's also a free course called ChatGPT for medical writers and people that write about medical topics. That's a free 20-minute course that will help you get up and running and includes prompts and all the things that will help you implement ChatGPT and other AI into your work. Hope you'll check it out at learnamasstyle.com. All right, that's it for this week. Thanks so much, and I'll be back next week. Thank you.